Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, January 26th, 2021. We are 1 year and 1 day post the first COVID case here in the Chicago area. So it has certainly been a year. Thank you to the many of you who have been following along on our Facebook updates. We've done well over 100. Early on, we were doing them as often as 7 days a week, but they remain your best place to get your questions answered directly. When we don't get to them directly, we do continue to update the website, and I'm going to show you today a lot of the vaccine information in particular that is available. Please, as always, chicago.gov/coronavirus can be your landing place for all things COVID. Right up at the top, there's a vaccine tab. You can also get there directly by going to chi.gov/COVIDVAX, COVID VAX. You can put your questions directly into the box below, or you can use the hashtag AskDrArwady on Twitter or Facebook. So with that, let's take a quick look first at our dashboard data. chi.gov/COVID-, and if you've been following along, our COVID numbers continue to look really good here. You can see that today our positivity is at 7.2%, and we're at 728 new cases on average per day. That's down from a peak of about 16% positivity back at the peak of this second surge here in November, and from 2,400 on average in days with as many as 3,000 new cases. So really good progress there. The testing numbers look good overall, and generally things have been heading the right way. Obviously, a big piece of news over this last week since we last spoke was that limited capacity was able to reopen for indoor dining. And I just wanted to make sure people understood why that was able to happen. As always, we've continued to follow these same metrics. There's 3 metrics that we have to hit to be able to move ahead. And so for the case of being able to move into that indoor dining, we had to have a sustained positivity rate under 8%, which you can see we've been doing very nicely with. We had to have adequate capacity, more than 20%. In our ICUs, we're at about 27 and 28%, no issues there. And we had to have a continued decline in COVID hospitalizations. And all of those we're doing really, really well on. So we continue to follow these same metrics that we've been using related to reopening. And there are still a lot of limits in place. So where that reopening has happened, it's still set to 25% capacity, limit of 4 people at a table right now. We'll keep following the data. And if we continue to see things moving in the right direction, we'll be able to take some more cautious reopening steps. Obviously, that followed on the heels of being able to, again, cautiously with a lot of limits on it, reopen some of the museums, reopen some of the fitness activities, other things that I know people have been missing. Please rest assured, we are very carefully watching this data. We are very carefully tracking the news about variants and monitoring to make sure that if we start to see any signs of concerns here, we may need to pull back again. But right now, the news on the COVID front is really very good. I also wanted to just highlight some of the vaccine data. So I imagine many of your questions are going to be vaccine. We're in our second day in phase 1B here, which means technically vaccine is now everybody over the age of 65 and everybody in the frontline essential worker groups is eligible for vaccine, although patients is very much the word of the day here. But if you go right up at the top here to the vaccine tab, please do explore this. So you can, in Chicago vaccine phases, learn when it's your turn. You can click down here and see where we are, what the tentative timeline looks like, when we'll be moving into different groups. You can also get some more details about who we mean by these groups. You can see the Chicago estimates for how many people fall into these groups. So for example, people 65 age and older, we estimate there's about 363,000 Chicagoans who are 65 and older. There's about 21,000 people who live in the non-healthcare residential settings. That's obviously in addition to the healthcare-based residential settings that we were working on in 1A and continue to work on. I want to make the point that we're not done with healthcare workers. We're not done with long-term cares and behavioral health and developmentally disabled and assisted living facilities, but we are adding on in 1B these other settings. And then these are the specific specific groups that are really our jumpstart. They represent the settings where we have seen the most COVID outbreaks and risk in Chicago, as well as education. And that is specifically, as you see, teachers, principals, student support, and student aides at pre-K through 12 schools, as well as daycare staff. And you can see that that group alone is about 142,000 people, and all these essential workers are another about 350,000. So what that tells us is, in addition to the hundreds of thousands of people who were already eligible in phase 1A, we have now opened eligibility to more than 360,000 people over 65 and more than 350,000 essential workers. And we continue to get just 34,000 first doses of vaccine per week at this point. So our limiting factor is very much vaccine. So I encourage you to explore some more on the website here where you have questions. There's also a lot of information here, things about ways that you can register. So most people are getting vaccinated through their healthcare provider, and we are seeing hospitals, clinics, doctors' offices, urgent care centers. We've been enrolling them over this last month. While we've been vaccinating healthcare workers, we've also we're up to more than 430 sites that are enrolled. The great majority of those healthcare settings are vaccinating their existing patient list. They are reaching out to the people who are oldest and have the most underlying conditions over 65 and inviting them in for appointments. It's important because that means that people in their 80s and their 90s, they don't need to know how to navigate, a website or know how to find an appointment. We really are working with these providers to have them bring patients in, and there are thousands and thousands and thousands of those appointments that have already happened and are continuing to happen. Again, there is some prioritization there. There's not enough for everybody, and so we have asked our healthcare partners to prioritize those at highest risk. Secondly, pharmacies. We've got more than 140 pharmacy sites enrolled. Here are links to some of the pharmacy chains where we are sending vaccine in Chicago. And then people in the prioritized essential worker groups, like I just showed, will be getting vaccine through employers. So right now, we're already underway with some of those very highest risk settings. We're vaccinating first responders. We're getting vaccine for correctional officers, where we've seen really significant outbreaks. We're working on some of the manufacturing settings where we've had major outbreaks and some ongoing risk settings where it's hard to have all of the mitigation factors in place, and settings that disproportionately have people working in them in some of our hardest hit neighborhoods. And we have a vaccination finder map here, you'll see, that shows you these are settings that have, this does not include sort of private clinics or individual providers that don't have any availability for the public. Again, there is not a lot of vaccine availability. I'm just going to be perfectly honest with you in terms of appointments right now. But there will be more really each week as we get more vaccine, and building the capacity to be able to send vaccine out to more than 400 providers across Chicago gives us the ability to very rapidly be able to ramp up access to vaccine, hopefully as more becomes available over the next few weeks. I also just want to highlight here that there's information here for employers who have questions about enrolling as a vaccinator, how City of Chicago pods fit in. City of Chicago pods are really only going to be eligible for small employers, definitely settings that have less than 250, and in a lot of cases really less than 50 employers. And so just to talk a little bit more about that, where we've got really large employers like these factories, like our school systems, like our police department, we bring vaccine to those work settings. We use the pods for the unconnected people. So for example, we've had a lot of focus on making sure home health aides can get in. We'll be using some of those pods for daycare workers, for example, who often work in settings that have 3, 4, 5, 10 employees. It doesn't make sense operationally for us to bring vaccine to a site that has 3 employees. Instead, we ask those employees to really come into the pod sites, whereas for a larger factory, manufacturing setting, a school, we instead direct vaccine through those school systems. They do their own prioritization and planning and then make it available through employers. Everybody in 1B is now eligible for vaccine. So if you are an essential worker in these categories that have been defined, you are welcome to get vaccine through your provider, through a pharmacy, but the employer-based vaccines will really be rolling out over February and March. And then maybe just the last thing here, If, try COVID Coach. You can continue to sign up there if you want to make sure you're getting the most updated information. We'll be sharing additional resources here as we have availability at, for example, some of our Chicago pods. We are still 100% booked with 1A healthcare workers. We still have literally thousands of unaffiliated healthcare workers, meaning they don't work in a hospital setting or they're not in a clinic that's receiving vaccine. These are our physical therapists, our dental folks, et cetera. And we're still getting, a couple thousand of them in, every day who are still needing vaccine access. So when there is availability for the general public more broadly, or for some of these other employer groups, we will be sharing some ways that people will be able to sign up for that. But you'll see that where we say ways to register right now, we don't highlight the City of Chicago pods in the same way that we don't highlight all of the strike teams. We've got more than 250 locations that have been getting strike teams. This week, we're working with partners to expand that, going into some of the homeless shelters. That will continue to expand out to encampments. There's a lot of work that happens, but it's not publicly available, but it does work to really push vaccine where it's most needed. I think maybe the last thing is let's look quickly at some of the data. Again, I encourage you to explore this yourself. But you can see yesterday, if you didn't see, there was a press conference where we shared some of the plans to really work on getting vaccine into neighborhoods where we are seeing much lower vaccination uptake, and or there are a lot of barriers in places where, for example, in this community vulnerability index, we looked at where in Chicago are there a lot of people who live below the poverty line but also are uninsured, don't have a primary care provider, where we think about how important that is in our vaccine planning strategies, where there are a lot of essential workers, where we'll want to over-direct potentially to larger employers, where there are a lot of people with underlying conditions and those who are over 65, and then where we've had a high COVID burden here in Chicago. So where we've had a lot of cases, hospitalizations, and deaths. Use that to prioritize some communities. We also talked about some of this race ethnicity data. This is newly available, so maybe I'll pull it up just to give you a sense of this. So where we look at our vaccines administered by race ethnicity, you see these are estimates because where there is missing race ethnicity data, there's some information on the bottom. We are using a validated statistical method that we've worked all summer actually on, where there was missing testing data to be ready for potentially missing vaccination race ethnicity data, even while we continue to work to improve the computer connections here. But what you can see is that the percentage of our first doses here have really disproportionately been taken up by white Chicagoans and Asian Chicagoans. Good news is that one of every 25 Chicagoans has gotten at least their first dose of vaccine. And that's great, but when you turn these first dose population coverages, that would be a 4% coverage, that becomes for Latinx, it's about 1 in 45 Chicagoans. Or if you look at for Black Chicagoans, about 1 in 53 Chicagoans, whereas 1 in every 18 white Chicagoans, 1 in every 13 Asian Chicagoans has actually already started the vaccination series. So in no way are we limiting access to vaccines, but we do need to over-direct vaccine to some of the communities where we're just not seeing as much uptake. And a lot of this is because 1A, it has specifically been about healthcare workers and who works in healthcare and who was raising their hand first in terms of getting vaccines. So we're certainly not done with healthcare workers. The last map I'll show you is this zip code work. So if we look at, for example, the first dose population coverage by zip code, this is where every single day we update data based on the residence of where people live. We always report out all data by Chicago residents. So there have been more than 160,000 vaccines that have already been administered in Chicago, but a lot of those have not gone to Chicago residents. Not a problem, but they don't show up then in our Chicago data. At the very bottom of that list, you can, if you're interested in that, you can explore because we do have that available. But for Chicago residents, where we are over about 108,000 first doses, you can see if we look at the percentage of the zip code that's been covered here, we range in the lightest blue here from zip codes, 0% would be O'Hare, right? People don't live at O'Hare, but up to less than 2.5% vaccinated. And then in some of the darkest blue, we've got zip codes that are really between about 10% or even more vaccinated. There's this one zip code that's 18.5%, but actually if you explore here and take a look, it turns out it's right here in the loop, and if you highlight it, oops, it's hard to just see the way this is showing. Let me move it over, there we go. It's actually that only 195 people have been vaccinated in that zip code, but so few people live in that zip code that it turns out that that's about 19% of the zip code, and we know that's where a lot of healthcare workers live. So I encourage you to just explore a little more, but you can see the pattern broadly that unfortunately our south and west sides, which again are the places that are predominantly driving a lot of the highest COVID risk in Chicago, where we're seeing more spread, more risk for variants emerging, are also, at least so far, the places where we've just not seen as much vaccination. So the mayor announced yesterday some strategies to work to bring additional vaccine into these communities to ensure that we can work with community leaders to bring the rates of vaccination up to the city average, basically. So I will stop showing that, but I encourage you to keep looking. There's a lot more on the vaccine website, lots of frequently asked questions, and I'd love you to take a look and let us know what questions you have. Let's move into people's direct questions. All right, so Tiffany Hagstrom on Facebook. How does an employer of people in 1B register to have a vaccinating partner come on site to do vaccinations? So on that chi.gov/COVIDVax website, there was a tab that I showed you briefly for employers. That's got the information for you. If you are an employer with fewer than 250 people, there's a survey for you to fill out. If you're one of the larger employers, there's some separate outreach that's happening to get you connected. But that is your first stop. There's also, importantly, if you're an employer in 1B or even in 1C, there's some materials there. We want everybody to start getting, thinking about what might it look like if I want to be an employer helping my folks get vaccinated. There's some work that you can do now to build confidence, to do some surveying around whether people want to get vaccine. There's materials there, and there are industry groups that are happening at the city level really planning out. It's just that we're obviously mostly focused right now on those 1B groups. But lots of work is happening and all kinds of plans in place to push vaccine through employers. That is in addition to the primary way, again, that people are getting vaccinated through healthcare partners. And I do want to highlight that the biggest thing holding us back on this is just the amount of vaccine. All right, Robin McCarthy on Facebook. No facilities in Chicago have open vaccine appointments as of yesterday. When will more openings occur? Right. So this is where, again, some patience and just recognizing that we are getting so little vaccine compared to what is available. We absolutely plan to be able to be putting more appointments online as there is more availability. We do push vaccine out every week, just so you know. We work on a weekly planning cycle so that our pharmacy partners, our clinical partners, our own pods, we know how much we get in a week, and then we're sharing in advance so that people know how much vaccine they're getting and can make appointments available. So we have worked, and actually the new federal administration has committed to giving us much more visibility into how much vaccine is coming, even if the news is not great, because it's very hard, of course, for everybody to do all of the planning that is necessary when you literally we've been finding out less than a week in advance how much vaccine we'd get the following week. So we know, unfortunately, it doesn't look like we're going to get significant increase in vaccine here for at least the next 2 to 3 weeks. But at least knowing that lets us plan and lets our partners understand how much vaccine they're likely to get, then make vaccine appointments available for the public. But I would just say that, and we'll share some more. I've asked the team to think about, does it make sense to have time frames when things are available? There will be some more information later this week. Again, as we start to have as we've gotten more of the Chicago pods done for 1A healthcare workers, some more ability to link folks in, and we'll talk some more about that. But again, if you're in that 65 plus group, your first bet is really through a hospital system, through your healthcare provider. We're enrolling really dozens more every day there. And otherwise, checking through those pharmacies. And again, patients. Most people who are eligible are going to be vaccinated in February and even March. And that will go faster if we get more vaccine. It may go slower if we don't see vaccine increases like we expect. And just because you get vaccinated, of course, you've got to keep doing all of the other mitigation things that work. At Shaw PhD on Facebook, why are some teacher vaccinations being canceled? Okay, so I think this is probably in reference. I had heard from the team that, there was an issue over the weekend where, again, all of our City of Chicago pods, points of dispensing, these are the ones at city colleges, for example, we're doing a lot of vaccinating in those settings, but they are for unaffiliated healthcare workers. And there was, to give you a little bit of a look behind the scenes on how that works, we work through employers, just as we will continue to do moving forward. And so we had and we have some specific codes that are available that will then be made available for employers to ensure that their folks are able to kind of get appointments. And that is similar to what we will use, again, to make sure that we can get these people in for appointments. And so there was a code that was specifically available for home health care workers, who, of course, are some of the people we most want to get vaccinated, because every single day they are in homes in Chicago doing hands-on care with our most vulnerable residents. And they work often very independently. There's not a central place for us to bring vaccine to them. And there was a code, we know how many workers approximately we expect to use some of those slots. And I do think, we just saw thousands and thousands more people using that code than were anticipated. And what we saw is that, people were being truthful and were checking, not that they were a healthcare worker, et cetera, but that they were another type of employment. And, first, I really want to, say I'm really glad people are wanting to get vaccinated. And I'm really glad people are being honest when they are filling out that form. Even, if they got a code, there was some code sharing. And being honest and saying, I'm not one of these healthcare workers. When we have 8,000 and 9,000 appointments that do need to go to these higher risk groups, we did have to send out some sort of cancellation notices to people who checked other, teachers, whoever it was, just to say, I'm not annoyed with any individual person at all on that, because I know everybody's pretty anxious to get vaccine, but just the truth of the matter is, if codes are shared in ways beyond what they're meant to be, we then are not able to get those folks vaccinated. So for teachers in particular who may have tried to use those codes, please rest assured there are plans in place to get you vaccine through your employer, private, parochial, public. CPS on Friday, for example, did release in a lot of detail its plan for prioritization even within its workforce. That's the other thing, right? We make vaccine available through employers, and then there's work there. So CPS was looking to say, who has potentially some of the higher risk exposures within the school setting, and has done some prioritization there as well. So again, we can post the link if you're interested, if you're about CPS in particular, but everybody's making those plans. And we've asked grocery store workers to do the same thing, right? Like what shifts, what are your plans? We provide vaccine, we help connect people to vaccinating partners. In the case of grocery store workers, especially the big ones, there's often pharmacies that are within grocery stores. They can become the vaccinating partner for that grocery store, whereas much smaller grocery store settings, we need to work a little bit harder behind the scenes to connect them to pods, to connect them to pharmacies, to connect them to clinics and other vaccinating partners. So there is a lot of matching that is happening on that employer side as we work through the group. But please, you will know if you're in an employer-based setting and it's your turn to be able to really get vaccine. We have obviously prioritized educators. They're in that February group. And you'll be receiving information for no matter what group you're in. You'll get information from your employer with the specific directions on when we'll be making vaccine available to you. And anybody over 65 and anybody in that group, again, at any point is welcome to get vaccine if you've got an appointment with a doctor who has vaccine, if you're able to get in through one of the pharmacies, et cetera. Donna Cameron from Facebook. Do I know when the Johnson & Johnson vaccine will be available? I do not know, but it is one of the questions I am the most interested in, and we've been following it really closely. So for those who maybe haven't been following, we of course have 2 approved vaccines right now, Pfizer and Moderna, and there's 2 more on the horizon, Johnson & Johnson and then the AstraZeneca. And there are some others, like Merck, for example, had some vaccines in trials and ended up abandoning those trials where it just was not proving to be protective enough. And that's how these trials work. You have to finish the full trials for safety and efficacy for any vaccine. And so it's the same reason that we don't skip any steps. Obviously, no steps can also be skipped for the Johnson & Johnson. One of the reasons we like Johnson & Johnson is that one of the arms of the trial was a single dose vaccine. Logistically, it would be a lot easier for us to, of course, be able to get folks vaccinated and protected with a single dose, especially if you think about transient settings, emergency departments, or homeless shelters, or anything. But even more, there's double the work and double the logistics when we got to get second doses. Also, it only needs refrigeration instead of the freezer or the ultra cold, and that would also significantly open up our ability to be vaccinating in some other settings. So we're excited about it. But we have to wait for the trials to finish. I am sort of unofficially hearing that we may be seeing those trials finishing up possibly in the next couple of weeks. If that happens, then the FDA has to do the entire approval process. That also takes an average of a couple of weeks. The CDC has to look and review. So I'm hopeful. It's certainly one of the reasons why I think it's possible that when we're looking more at later February, kind of early March, we may start to see some more vaccine, both because the new administration has really committed to putting a lot of resources into increasing production of the 2 existing vaccines, but that there are other vaccines potentially on the horizon. I think realistically it's going to be more like March before we're seeing those, but we'll see. But we have a lot of, everybody is impatient around it, but the corollary is that all of the same safety and efficacy, you've got to follow people for the right amount of time, know that we can have protection, remain in place. So I will certainly share with you as we learn more about that officially. Linda Williams from Facebook. What if you had COVID and now it's gone, but you still have the cough and shortness of breath? Okay, so I would definitely encourage you, if you haven't already, to check in with your doctor. We know that there are people who continue to have some symptoms of COVID that can last for a long time. There's this long haul COVID term that we're still learning about. I don't know what your time frame is. If we're talking about a couple of weeks out, that's not unusual. If we're talking about months out, it would be important that you're checking in just to make sure that there's not something else going on. Right? Things can give you cough and shortness of breath that are not even COVID. So that would be my primary recommendation there. Okay. At VaxPMO from Twitter, the latest data from the website shows a pattern of a weekend slowdown. I presume that means for vaccine. The city swung from 10,000 on Friday to less than 2,000 on Sunday. 7-day average, 6,745 per day. Look at you, you're doing exactly the kind of math we do on this data. Nicely done. Is the weekend dip supply driven? If there isn't enough supply each week, on what day do we run out? Okay, that's a really good question. So if we take 34,000 doses of vaccine a day and we divide them, over those 7 days, we're averaging sort of in that 4,000 to 5,000-ish per day. Now remember, there are Chicago residents who are vaccinated outside Chicago, and there are a lot of non-Chicago residents who are vaccinated inside Chicago. But regardless, over this last week, as you know, we've been averaging a little bit more than what we've been receiving, and that is making up for where there have been some, some slower starts for people who were just coming on in the first week. Like you heard me say, every week we know how much vaccine we're receiving. That vaccine gets allocated and distributed either directly or through the Chicago Department of Public Health, generally Mondays, Tuesdays, sometimes leading into Wednesdays. It depends a little bit on shipping, right? This is all sort of coming from central sites. We direct it locally at Chicago, but it depends, if you've got a big snowstorm like we have right now, it would not be unusual for us to perhaps see a couple of days delay in when vaccine arrives, because it's literally coming every week. We then have really asked our providers, we want them using all the vaccine that they receive that week. And that is a goal. We're not there yet, but it's been getting better every day. There's work behind the scenes then to make sure that the second doses are sort of available, and there's a lot of complications there. But the weekend dip is broadly supply driven then, because people have mostly used up their vaccine, and then we see more kick in. I think the fact that we're seeing this pattern of like Wednesdays, Thursdays, Fridays being our biggest vaccine days is likely to continue. Because again, if clinics and hospital settings and pharmacies are receiving vaccine sort of on a Monday, Tuesday, Wednesday, they're then going to be giving it largely on a Wednesday, Thursday, Friday, probably into Saturday. And then Sundays are a combination of us having gotten through vaccine and just that a lot of the clinical settings in particular may not be as operational on a Sunday, so they would be working to get their folks scheduled, more in the time frame when they're there. So as we hopefully get more and more vaccine coming in, again, if you do the math, more than 400 providers, 34,000 vaccines, that's not a lot of vaccines per provider. As we have more vaccine available, we've been having a lot of conversations about the ability to, have some even larger mass vaccination sites. We already, for the city pods, we have Saturday hours, we have evening hours, et cetera. But right now, the thing holding us back from doing more of that, honestly, is vaccine supply. So there's a ton of work happening, but I hope that helps just clarify some of what's happening. And I love that you're looking at the data that closely, because that's what we do too. Richard Benson from Facebook: is there a prioritization between first and second doses? Would a second dose needing person be given a dose before a new first dose appointment? Okay, so let me just make sure I think I understand the question. We want to make sure that everybody who needs a second dose gets a second dose. And we actually are providing each week and are provided each week second doses, which we talk about separately from these first doses. So when I say 34,000 first doses, I mean 34,000 first doses. Separate from behind the scenes, we have the amount of vaccine for the people who got their first dose 3 weeks ago or 4 weeks ago. So we continue here in Chicago to adhere to the CDC and ACIP and FDA really requirements around the use of this vaccine, which this vaccine is approved for use in 2-dose regimens. And certainly a priority is making sure that people get those second doses on time. Okay, Mary Hidalgo from Facebook: 65-year-old residents without a doctor can get vaccination. Where and how on the north side? So pharmacies are going to be one of your best bets if you don't have a doctor and you're not connected. Increasingly, especially as some of our larger hospital settings and others are getting through some of their enrolled patient populations, there will be some more opportunities there, and we will have some centralized ways to share some of that out. But I would say that pharmacies are one of your best bets if you're not connected to healthcare at all. Without a doctor also means, if you've gotten care in the past, so if you were seen at one of the hospitals, if you're in one of these larger network systems, even if it's not a primary care doctor, that would be a good place for you to potentially reach out and see. And I will just note that the north side of Chicago has had much more intense competition for vaccine than the south and west sides, right? This is sort of what we see on this map. And yesterday, when we were really announcing the strategy, we were at St. Bernard's Hospital, and they are not overrun with people looking for vaccine. So again, we're working hard to make sure that vaccine gets to settings where it's most needed. So I would encourage you to be checking with pharmacies and think broadly about that without a doctor phase. If you're over 65, as the month, as the time goes on here, and we get into, and if you don't have a doctor, it is true, you're going to be less likely to, and if you're 65, you're not 85, you're not 95, it is less likely that you're going to get a vaccine this week or next week or even the next week. It would be more likely, I would think, in March that you would be able to get vaccine. Okay. Lots of things coming in here. Charlotte Sangster from Facebook. I work for Jewel Osco. We don't have vaccine. Why is that? You actually do have vaccine. Now, I don't know which Jewel Osco you work for. I don't know the details. Are you in Chicago, out of it? Remember, we supply the city of Chicago locations with COVID vaccine, and Jewel Osco definitely is one of the settings that is receiving vaccine. Now, what I will say is it is possible that all the Jewel Oscos would not necessarily have doses available to the public, where Jewel Oscos may be helping vaccinate grocery store workers, where Jewel Osco is based within it, where they may be partnering to bring vaccine to some of the other settings that may need it. Just because a pharmacy has received vaccine does not necessarily mean that it is available to all comers. But again, the websites for those pharmacies do let you know if there are appointments available, and just honestly, there are not appointments available right now this week, given all of the demand versus supply. Larry Lev, is age 65 based on your actual birthday or the calendar year in which you turn 65? It is based on your actual birthday. So when you turn 65, you become eligible to receive vaccine based on your age, whenever that is. At Don't Panic 1962, will we have to take a COVID-19 vaccine shot every year, or will it be in the cocktail vaccines we get every year for influenza? Is the COVID-19 virus in the same family of viruses from the 1918 pandemic? Okay, so no, the COVID-19 virus is not at all even the slightest bit related to the family of viruses from the 1918 pandemic, because the 1918 pandemic was influenza, AKA flu. And as you note, every year we have to make a new flu influenza vaccine because there are so many different strains of influenza. There's a lot of mutation, if that's the word you want to use, for influenza, that every year we look and see what are the most common strains that are circulating and create a vaccine for that year. The good news is, although certainly there is concern about some of these new variants, we have not seen at this point enough change and variation that seriously threatens vaccines. And but time will tell here. I think we, again, have been, everything looks very good in terms of the immunity, things that you can follow in the blood here related to COVID vaccine. But we'll be following people in these trials, for a number of years, continuing to see what the levels of various antibodies and other protective parts of your immune system look like, and then watching to see if there are enough significant changes, emergence of variants, et cetera, that additional booster vaccine may be necessary. So I can't fully answer that question yet, but what I can say is that the vaccines that are available now work very well against all of the COVID strains that are here, and people taking them now and us getting our COVID numbers down now decreases the chance for additional spread, especially of variants. So we will see, but right now I don't think it's likely to be an annual shot, but time will tell. I love this comment, you guys. Rex Ingram on Facebook and Sarah Dandells on Facebook are having this conversation. Dr. Harvey, when all this is over, what will you do? And Sarah's answering, hopefully a vacation and naps. So, the good thing is, although I certainly did not expect a year like this. Some of you may or may not know that I formally came into the commissioner role at the Chicago Department of Public Health. The City Council approved me on a Wednesday, I think January 15th, and we activated for COVID that next Sunday. So I had about 4 days that were not already part of COVID. So I don't know any role here that has not had a lot of COVID in it. But the good news is, as you know, honest to God, there is nothing I would rather be doing in the entire world than this work that I am doing. It is the work that I am best trained for. It is the work that I find most interesting, and I care so much about getting past COVID, but also taking like the things that we're learning from COVID, the investments that we're making, and using them to build a stronger public health system. Like for Chicago, we know how to do this. It's just about making that commitment, and particularly at the federal level. COVID has highlighted many, many gaps in our public health system, and it's not a surprise when public health has not been well funded, honestly, for decades. And I really am excited to be part of what comes next here related to building an even stronger public health system, what that looks like for Chicago, but honestly what that looks like for the country too. I have had opportunities I've been offered other job opportunities while I've been in this role, and I've said no way. Like, I am in this for the long haul. There's no chance that I would move away at this point voluntarily while we're still fighting COVID. And honestly, I'm really happy doing the work that I'm doing. I love my team. So I certainly will want a vacation and a nap, to Sarah's point. Some people have been asking me, when will that vacation be? And I don't know yet, right? And you can't use my vacation plans to try to make your own vacation plans. But I am confident that later this year, I will have the opportunity to take a vacation, as will all of you, assuming that we can keep making the progress we're seeing against COVID, keep making the really good progress that we're seeing in terms of vaccine rollout and uptake, and that this becomes something that we're really seeing across Chicago. And naps are already very much part of my strategy. So I think I'll just end on the good news. Slightly gave me the idea from the naps is that I did, as some of you know, I was able to get my second dose last Thursday. It's actually why we didn't have our Facebook live, because we were doing an event related to vaccine, press conference, et cetera. And, I've been actually really lucky. After both of my doses, I had virtually no side effects. A little bit of a sore arm, but only in the way that, like, if I push on it, I could sort of feel like maybe there was a little bit of a, like I'd had a vaccine, basically. Now, what's funny, though, is if you look at this, like, some of the common side effects are like fatigue and feeling tired. And it's a little hard for me to assess this because I'm a little tired all the time right now, because everybody, not just at the health department, but, hundreds of people across the city are working so hard on this vaccine rollout. But I didn't feel any more tired than I was related to having gotten this vaccine. So, that for me has been really good news. And I know vaccine envy is real. I feel for those of you who are really wanting to get that vaccine and just can't get a slot yet. Please rest assured, there will be slots available. We've got all kinds of things in place to grow this as more vaccine comes. And know that we are also working to push vaccine into the settings that will get us past COVID, which indirectly helps decrease everyone's risk. So thanks so much for tuning in. We will certainly be back to answer your questions again on Thursday. If we didn't get to them, check the website. We keep putting more and more up there. And sign up in Chai COVID Coach if you're feeling like you just want to make sure you're getting notifications. With that, I think we will be back on Thursday. Be safe, Chicago.